Welcome everyone to this training on fall prevention and safe mobility for older adults. Stay safe, stay strong. My name is Mansha Mirza, and by clinical training, I am an occupational therapist. I am also a professor in the Department of Occupational Therapy at the University of Illinois, Chicago. And I also lead ASIAN, which is a federally funded National Technical Assistance and Resource Center. And ASIAN spells out as Aging Services Inclusive of Asian American Older Adults. And I am happy to be here today and share some information with you about fall prevention and safe mobility. All right. Let's do a quick overview of all the topics that we will be discussing in today's training. So we will be talking more deeply about what a fall is and understanding the different types of falls. We will be talking about different risk factors associated with falls, how falls can be prevented in older adults, how to talk to the doctor about falling or fear of falling, home inspections to make sure the home environment is safe. We will also be sharing with you some helpful resources that you can access after this training. And then, of course, I'm hoping we have some time at the end for questions and answers. All right, so here's why it's important for everyone to have this conversation. Falls are serious and they're costly. More than 1 out of 4 Americans aged 65 years and older falls each year. In 2020, emergency departments recorded 3 million visits of older adults. So these were people who showed up in the ER after having had a fall. Over 800,000 patients per year are hospitalized after a fall. So they might first present in the ER, and then their injuries might be deemed serious enough by the attending doctor to ask for them to become admitted for more intensive treatment. And this is most likely because 1 out of 5 falls causes broken bones or head injury, both of which require more intensive treatment and inpatient hospital stays. Speaking of broken bones, hip fractures are very, very common in older adults after a fall, typically after they fall sideways. And hip fractures are also a common cause for hospitalization in older adults. So the bottom line here is that falls are serious and they are very costly for the healthcare system, which is why it's important to make sure we prevent falling in older adults. All right, let's begin by first defining what a fall is. So, a fall is defined as an unintentional event that results in an individual coming to rest on the ground, the floor, or a lower level. So, if someone stumbles momentarily, but if they're able to regain their balance without hitting the ground or the floor or flopping back on their bed, technically that would not be considered a fall. It would be considered a near fall. And that's a good thing that they were able to regain their balance. So fall is technically when the person loses their balance to the point where they come to rest on the ground, on the floor, or a lower level. There are different types of falls. So a slip is when the person loses balance when they're walking on a slippery surface, such as wet floors or ice. A trip is when someone loses balance when they're stepping over an obstacle or an uneven surface. And a stumble is when people trip over their own feet or lose balance momentarily with no known identifiable reason in their environment. So it's not like they were walking on a slippery surface. It's not like they stumbled on something that was in their path. They just stumbled over their own feet or got dizzy and lost their balance. So these are the 3 different types of falls. What is something that you see in common across all 3?
They're losing their balance.
Loss of balance, that's correct. right? So regardless of whether it's a slip, a trip, or a stumble, the common factor that precedes all falls is loss of balance. Something to keep in mind as we discuss fall prevention later on in this training. Now, falls, regardless of whether they cause serious injury or not, can significantly affect the quality of life of the individual who has fallen. And this is something, honestly, we don't just see in older adults, we even see in younger people, that after someone has fallen once, they develop a huge fear of falling. This is more common, of course, in older adults. And when the fear of falling sets in, people start to limit their physical activities and their social engagements. Because there's this perception that if I stay put, I stay at home, I don't go outdoors, I'm going to be safe and I won't fall anymore. But in reality, this is actually counterproductive, as we will see further along in this training. All right, so at this point, I'd like to hear a little bit about your own experience. So even if you haven't fallen, maybe you've observed someone fall or heard about someone falling or are helping someone who has had falls in recent times. So here is a QR code. If you could just go ahead and complete the brief survey that I have, and then we'll look at what everyone shares on that. So I'm going to momentarily stop sharing this slide, and I'm going to pull up the Poll Everywhere screen so we can look at what you report. All right, you should now all be seeing my Poll Everywhere screen. So it looks like everyone who took this survey has known someone or personally experienced a slip, a trip, or a stumble in the past 6 months. Yeah, so just goes to show how common falls are around us. All right. And then I don't know if you did the next question. So the next question is, I'm going to escape out of here. So the next question is, if you have witnessed someone falling or known someone fall in the past 6 months, who did you tell about the fall?
Is there a way to go back? I was unable to answer.
That's all right. You can just, share verbally or type in the chat, and I can stop this screen. So, were you able to report the fall to someone?
Yeah.
Yeah. And who was that?
It was the spouse.
Okay.
It was a neighbor that fell in the
Right.
snow.
Okay. Yeah. What about others? Were you able to report that incident to someone?
Sure. Sorry. So we were trying to do it in the poll app, but we weren't able to. So we've had our homemakers have their clients have falls, and so they've reported them to 911 and emergency
Right.
services, and then reported them to us for kind of follow up as well.
Right. Yeah. So it sounds like in those situations, the homemakers followed the protocol and they did the right thing. Um, so surprisingly, and Yeah, surprisingly, what happens a lot of times is that older adults themselves don't always report having fallen to people around them if they're living alone, which is why in these types of trainings, I ask this question because I don't know what it is. I don't know if it is stigma or if they worry that they might be prescribed a mobility aid and they don't want to use one. But people are somehow reticent about falling and reporting falls, which again is counterproductive because in the least you should be telling someone who lives with you, like, so, Peter, you reported to your neighbor's partner about their fall. So someone who lives with you who can monitor you more closely, keep an eye on you, but also you need to report to your healthcare provider. And we will talk about what details should be reported a bit later in the presentation. So this was just, my way of getting to know, if people have witnessed falls or experienced falls themselves and what was their immediate response about reporting them. All right, so I mentioned earlier that I also lead the Asian Technical Assistance and Resource Center, and our focus is on Asian American older adults. So we've done some investigation into falls and incidents of falls among Asian American older adults, and we found a few things. First, we found that the research is a bit inconsistent about fall incidents. So some research indicates that falls are more common among Asian Americans compared to other racial ethnic groups. Other research reports it otherwise. We've also found that because this is a broad umbrella category, there might be variations in fall risk and fall incidence between different subgroups of Asian Americans. We've also found from research that Asian American older adults are more likely to avoid talking about falls. So this is the group that is less likely to report their fall even to their adult children because they don't want them to worry. There's also fatalistic view about falls, like it was destined to happen. There was nothing I could have done to control it. It had to happen, and it happened. And that leads to the next point, which is, having limited knowledge about fall prevention, because falling or frequent falling should not be anybody's destiny. There are definitely ways to prevent it and precautions to take to avoid falling among older adults. All right, so next we're going to talk about some common myths and misperceptions about falling. So I'm going to read each statement here, and I need you to let me know if you think it is true or false. So for those of you who have joined the meeting by Zoom, you can just put your answer in the chat. You can just put true or false in the chat, and then for those of you who are just like watching on the big screen, you can just call out your answer out loud. So the first statement is falling is a normal part of aging. Is it true or false? All right, let's see. Let's come up in the chat. All right, yes. So you are both correct. Falling is not a normal part of aging, right? And that's a huge misperception, especially as we're seeing among Asian American older adults. Like, it's part of getting older, it was destined to happen. No, falling is actually abnormal at any age, including at older ages. All right, next one. A person's risk of falling can change over time. True or false? All right, so once again, both responses are correct. A person's risk of falling can change over time. It could change because of change in their muscle strength. It could change because of changes in balance or their vision. And these changes don't always have to indicate a downward or a worsening trajectory, as in things got worse, so they might be at higher risk of falling. Things can actually get better. So a good example here would be, an older adult who has cataracts, and therefore the world looks blurry to them, and they're not able to see contrast in their environment anymore. And there's a simple fix to that, right? They get cataract surgery, their vision is now near perfect, and the world looks a lot clearer, which means they can see obstacles in their path a lot easier, and so their risk of falling actually goes down over time. So that's something to remember. It doesn't have to be a downward or a worsening trend. All right, next statement. You can reduce the risk of future falls even after experiencing one. All right, once again, you are both correct. You can indeed reduce the risk of future falls even after experiencing one. So it's not that someone fell and that's it. Now they have to confine themselves to their home forever. Absolutely not. They can definitely make changes within themselves and within their environment to decrease their risk of future falls. All right, last one. Falls mostly happen in outdoor settings. True or false? All right, so once again, you guys got this right. Maybe I didn't need to do this training because you guys are on top of all these different myths and misperceptions. So falls do not mostly happen in outdoor settings. More than 50% of falls in older adults happen inside the home, which is why when I said earlier that when people start fearing falls and they stop going out and about, thinking if they stay at home, they're going to fall less, that's counterproductive. The home environment can be just as hazardous as the outdoor environment. And we will see examples of that later in this presentation. All right, any questions so far before we move on to talk about risk factors associated with falling among older adults?
You might be covering this later, but I've seen in more than one occasion that someone who's in, let's say, stable health,
Yeah.
older adult falls, and then immediately after fall, they really do fall apart and to the point even of dying. It's happened to my uh, former father-in-law's brother, and I've seen it on the job a couple of times. Can you kind of speak to that?
Sure, yeah. I've experienced that too with my grandmother, fairly stable health, but she was 90 plus, but fairly stable health. She had a fall, and in her case, it resulted in a hip fracture. Remember from one of my earlier slides, a lot of falls
Hmm.
in older adults result in hip fractures. So when they took her to the ER, it led to a hospital admission, and they had to put her under general anesthesia to operate on her, and she just wasn't able to emerge from that. So that ended up being the reason for her passing away. So it really depends on the seriousness of the fall and the injury that results from the fall, right? So I wouldn't know the details about the specific people that you mentioned, but for instance, if they had a head injury, right,
He did have a
that
head
could,
injury. Yeah.
yeah, so that would mean a worse prognosis, right? It could also depend on the age of the individual because let's face it, the older we are, the harder it is for us to recover from injuries. So younger person might have had a better chance from recovering from that head injury, an older person maybe not so much. My grandmother had like a simple procedure done for her hip and she couldn't recover from it.
Hmm.
So
I'm sorry to hear that, by the way.
yeah, well, yeah, and I'm sorry to hear about the people that you mentioned as well. And that's unfortunate, which is why we say prevention is better than cure, right? Especially as people get older, preventing falls is definitely really, really critical because you cannot predict the seriousness of the injury the person will acquire and the type of management they will need after that. Does that answer your question?
Yes, thank you.
Any other questions?
I think we're okay for now.
Okay.
Thank you.
All right. So let's move on and talk about the risk factors for falling among older adults. We're going to talk about 4 categories of risk factors: age-related bodily changes, lifestyle factors, environmental risks, and social and economic factors. We'll talk about these one by one in more detail. So let's begin with age-related bodily changes. There are 3 types of changes that we need to be vigilant about. The first is changes in vision, and this one is kind of obvious, right? As people get older, their vision, deteriorates. They need correctional glasses. Some people might have cataracts. They need surgery. Some people might have glaucoma, where part of their field of vision gets blocked. So vision changes could make them less able to identify trip hazards in their environment, like maybe they walking on the sidewalk, they don't know there's a huge crack, right? They trip, they stumble, and they fall. So vision changes are an important age-related bodily change associated with risk of falling in older adults. The other one is changes in muscle strength. And this one in older adults is called sarcopenia. So sarcopenia is progressive loss of lean muscle mass as people get older. And when sarcopenia sets in, it kind of places the individual in a negative cycle because the person is losing muscle mass, which means that they're not as strong as they used to be, which means that their endurance is not as good. So they get afraid of pushing themselves physically and doing physical exercise, which in turn leads to more sarcopenia and more loss of muscle mass, and all of that kind of becomes a negative cycle. And why that is associated with falling is because loss of lower extremity strength is one of the reasons why older people are at high risk of falling. So a simple thing like getting up from a chair that doesn't have armrests that you can hold onto could pose someone with lower extremity weakness at risk of falling, because now their muscles are not strong enough to stabilize them as they rise from the chair, right? So this is something that we need to be vigilant about when it comes to age-related bodily changes in older adults. The third one is changes in balance. So this one can affect the individual's risk in a number of ways. First, you might have noticed a lot of older adults experience hearing loss as they get older and sometimes need correctional hearing aids, right? The hearing mechanism and the balance mechanism are both located in the inner ear. And because of the shared anatomy, impairment in one system can also cause impairment in the other system. Now, the other thing is, as you get older and as your hearing decreases, you need to put more effort into listening to and understanding conversations. And that cognitive load distracts you from focusing on or registering other things in your environment. So you might be so focused on hearing and making sense of a conversation that you did not notice that the floor was wet because it had just been mopped. Similarly, your brain doesn't have enough resources to focus on balance because so many of its resources are directed towards making sense of conversations because of the hearing loss, right? So that's one reason why balance becomes impaired as people get older. The other bodily change to keep in mind is incontinence. So bladder incontinence specifically becomes commoner as people get older, both in men and in women. And the reason why this is something that places people at risk of falling is if they have urge incontinence, which means that as soon as they feel the urge, they need to quickly rush to the bathroom. That means 2 things. 1, they're going to be rushing. And 2, they might be doing this in the middle of the night when the lights are turned off, both of which could place them at risk of falling as they're trying to get to the washroom. So 3 bodily changes that we need to keep in mind: vision, muscle strength and sarcopenia, balance, and incontinence. Actually, that's 4. All right. Next up is lifestyle factors. So, lack of physical activity is one of the most important lifestyle factors associated with risk of falling in older adults. The more physically active they are, the less likely they will be to fall. So physical activity is very important, and it is associated with the sarcopenia that I talked about earlier. If people are physically active, they're going to be less likely to lose lean muscle mass, which means that their lower extremities will remain stronger for longer, which means that they will be at lower risk of falling. This is also one reason why now increasingly older adults are being recommended resistance training in addition to cardio. So while it's important to do the types of exercises that get your heart beating faster and get your blood flowing, it's also important to do exercises with weights or resistant bands in order to prevent that sarcopenia or loss of lean muscle mass. The other lifestyle factor is diet, right? So for instance, if someone is vegetarian and doesn't have meat protein in their diet, and is not being watchful about including, good sources of iron in their diet, they might result in iron deficiency anemia. And one of the symptoms of that is dizziness, and that dizziness could be a precursor to loss of balance and falling. Similarly, if someone's diet is not high in protein or doesn't include sufficient sources of vitamin D, those things are associated with decrease in muscle mass and muscle strength. So those dietary deficiencies could place someone at higher risk of falling in the future. And then lastly, it's other substances that we might consume. So alcohol, this one is common sense, right? If you've noticed, people intoxicated, they're not able to walk in a straight line because alcohol does impair the balance mechanism in the brain. Now, what happens with people as they get older is that their alcohol tolerance decreases, which means that their body is not able to metabolize alcohol in the same way as when they were younger. So if they were younger and they could drink 2 glasses of wine and not feel hungover or dizzy after that, as they get older, they might notice that's not the case anymore, right? Which is why alcohol and drinking are risk factors associated with falling. The medications that someone might be taking might also affect their risk of falling. Some common medications that have this effect are sleep aids. So if someone is taking medication to help them sleep and stay asleep through the night, they might wake up the next morning feeling very groggy, and the grogginess could place them at risk of loss of balance and falling. A lot of older adults are on blood pressure medications. These medications are critical for preventing a stroke or heart failure. So I'm not saying people should stop taking these medications, but sometimes as a side effect, the blood pressure might fall too low, right? And this might be experienced especially when people are changing their positions. So if they're going from a lying down position to a sitting up position, in the medical world, we call that orthostatic hypotension. And that drop in blood pressure can cause dizziness, which again can place the individual at risk of falling. So these are, a few lifestyle factors to be aware of: physical activity level, dietary intake, medications, and alcohol consumption. All right, moving on to socioeconomic factors. So here we talk about 3 things. The first is health insurance. Now, why does health insurance matter? If someone is uninsured or if they're underinsured, they might restrict themselves from going to the doctor for things like changing their medication. So let's say they're finding themselves getting dizzy after taking their blood pressure medication. Someone who is underinsured might be hesitant to make a doctor's appointment just to discuss reducing the dose because they might be worried about the copay or the co-insurance. And that's where, health insurance factors into someone's risk of falling. They just end up not seeing their doctor enough to make the lifestyle changes they need to make to decrease their risk. Associated with health insurance is financial constraints. So, people living on a limited income, for instance, might not be able to eat a rich, balanced diet that is high in intake of, important vitamins like vitamin D, that is high in protein as well as in iron, all those. Things that are associated with risk of falling. So, financial constraints might also prevent people, like I said, from visiting with their healthcare provider or signing up to go to the gym, right? Signing up for a gym membership. So, those are the different ways in which financial constraints can affect a person's risk of falling. The third thing we'll talk about here is social isolation. So, social isolation affects risk of falling in indirect ways. Social isolation is typically seen in people who are dealing with clinical depression, which is why they withdraw from social engagement and activities. And depression has been known to be a risk factor for falling. The other thing to know about social isolation is if an older adult is living by themselves, they don't have anybody around them to notice important changes. For instance, if they're living with other people or are in close contact with other people, it's typically these other people in their lives who might notice things like, okay, so grandma now is not able to get up from a chair unassisted, right? She needs a chair with armrests because she's holding onto the chair in order to get up. Or uncle so and so now needs to use a wall for support, right, as they're moving from one room to another. So these kind of things indicate that the person might be getting weaker physically, and we've seen earlier that physical weakness and frailty can put someone at risk of falling. So if you're not living with people around you or have enough people around you to notice these important changes, they might go unreported for a while until something bad happens, like a serious fall or injury. So these are the three important socioeconomic factors associated with risk of falling. All right. So next up, we're going to talk about environmental risks. So what you're seeing on your screen are three different pictures of three different flights of stairs. Which one of these do you think is safest, where a person is least likely to stumble and fall?
The far right with the
Reflective tape.
hazard, yeah.
Yeah. And what about that picture gives you the sense that it would be safer?
Well, significantly compared to the other ones because each step is clearly defined. In the first picture, the floor pattern makes each step look distorted, so you're not able to tell. And then the middle one, it seems like the steps change as they go down. So the third one has all even, well-defined levels.
And they're shallow as well, so easy to step on, and they have guardrails on the side where the middle one does not.
Exactly. So you guys are hitting all the right notes here, right? So the picture on the right shows a flight of stairs with contrast tape marking for each step and also handrails on either side. And this seems to be outdoors on a sunny day, so things are clearer to see, right? Whereas the other two pictures, the one in the middle, first thing that I noticed when I saw that was there are no handrails on either side. Also, the steps are uneven, right? It looks like the first step is larger as you go up, and then the steps become smaller. Typically, uneven steps like that create a risk of falling because people aren't able to gauge how far they need to lift their foot to get to the next step. And then the one in the upper left corner, that one has handrails on either side, but the floor pattern is really confusing. I've used this picture in other trainings, and some people are like, I didn't even know those were stairs, right? Because it's hard to see because the pattern, the boxes or the squares or whatever are making it so hard to know when one step ends and another step begins. And also the lighting in that picture seems to be really poor, right? So environmental factors play an important role in a person's risk of falling. So here's another one, right? So you have the sidewalk on the left hand side on the screen plain, even surface. There are no craters or no holes. Whereas the one on the right, you can see a large crack in the sidewalk, and you can see, anybody could easily stumble and fall. And then I mentioned earlier that more than 50% of falls in older adults take place in their home. And typically those falls happen in the bathroom. Can you guess why, or would you have a sense of why?
Is it the transition from the going to the sitting to standing
Yeah,
without
so
support?
yeah, that's one thing, right? Like when you go to the bathroom, you have to sit on the commode, then stand, then walk a few feet, get into the shower. So a lot of transitions happening. What else
Surfaces
could
are
be?
also, I'm sorry, surfaces are also tile, and with any kind of moisture, they can be slick, not a lot of like carpet or traction in bathrooms typically.
Exactly. So surfaces can be slippery. The bathroom is the one place in the home where there could be like water spills more than any other place, right? Typically, the bathroom and the kitchen sink, right? And so that's why we see a lot of people slipping and falling in the bathroom. Because remember, the slip is the type of fall where you're on a surface where it's easy to lose your footing. So, the bathroom environment in the home is really important. It needs to be safe. As you can see with the picture on the left-hand side of your screen, it's a very dark bathroom. It's hard to figure out the sink. It's hard to figure out where to turn to get into the shower. The one on the right, a lot brighter, definitely well lit, a lot more spacious, right? So less crowding and less likelihood of tripping on something and falling. So because bathrooms are a common place for older adults to be falling within the home, we generally recommend environmental modifications in the bathroom. So some simple installations, right, like a handheld shower head or grab bars, right, both in the shower area or by the bathtub, can go a long way in preventing falls. So even if the person momentarily loses their balance, they can grab onto something and stabilize themselves. Using a shower head instead of an overhead shower means that they don't have to kind of rotate around to get water on their backs or in different parts of their body. They can just use their arms, right, to wet different areas or to get the soap off. Similarly, if it's a frail older adult who no longer has the endurance to stand in the shower, we recommend that they use shower chairs to make it safer to take a shower. We also recommend around the commode installing a safety frame that they can hold on to get up from the seated position, and then raising the toilet seat. So these products, right, raised toilet seats and the safety frames are available in most medical stores. And the reason why a raised seat is important is because the lower the toilet seat, the harder it is for someone to get up. The more leg strength you need to lift yourself up. So think about like sitting on the floor versus sitting on a chair. It's harder to get yourself up and off the floor. So similarly, if you're sitting on a low surface, it's going to be harder to get up. And if your leg strength is impaired in any way, that could put you at risk of falling. So just raising the level of the toilet seat by installing a raised seat can go a long way in improving bathroom safety. The other thing that's not shown here, but we strongly recommend, is placing non-skid mats. So, you'll see these at Walmart, at Walgreens. They have like suctions in the bottom, and you place them on the surface of the shower area or the bathtub so that the person doesn't slip, because wet areas are an environmental hazard for falling. So non-skid mats kind of stay put and they prevent the person from losing their footing. So these are all, the environmental modifications that we recommend to decrease risk of falling. A few more tips on preventing indoor falls. It's important to involve family members in this process, right? To do a quick inspection of the home to see that there are no trip hazards around. Maybe the older person can work with a family member or with their paid caregiver to inspect the home every now and again for any new risks or changes that may impact their safety so that they can take proactive steps to mitigate those impacts. Another thing that's a really easy fix, just make sure that all areas of the home are well lit. If the person has some type of urge incontinence, or if they frequently go to the bathroom at night, maybe have a night light on so that when they wake up and they have to rush to the bathroom, they're not like fumbling around to find the switch and turn it on. They could be supported in clearing all obstacles around the house, such as shoes, bags, power cords, to reduce the risk of tripping. We saw in the earlier picture with the stairs, and this one too, contrasting color strips. You know, they're really cheap and they're a very simple fix that can improve accessibility as well as safety for ascending and descending stairs. So all you need to do is tear off the strip and you just paste it to the edge of each step, and the contrast will really help people with low vision know when the next step is coming and how high they need to lift their feet to go to the next step. And like I mentioned earlier, consider using non-slip flooring materials in areas that are prone to moisture, such as right by the kitchen sink and in the bathroom, by the sink, by the commode, and in the bathtub or the shower area. So at this point, I want to share with all of you a couple of free resources. One of these is the Room by Room Tour Home Fit Guide that was developed by the American Association of Retired Persons. So the guide can be downloaded, and there is a link that we have on the bottom of the slide for you to go and explore it. But basically, it has a section for each area of the home: the foyer, the kitchen, the dining area, the living room, and some suggestions on what you should be looking out for to make sure that there are no fall hazards in the person's home environment. So that's the Room by Room Tour Guide by AARP. And then the other resource that we have for you was developed by an organization, a nonprofit called Rebuilding Together. This is a national organization that has different local chapters. So this resource was developed by one of our doctoral students in collaboration with Rebuilding Together in Metro Chicago. And this is just a one-page infographic on preventing falls at home. And it has a few tips that you could use to make sure that different areas of the home are safe and promote safe mobility for older adults. So when you're completing your post-training surveys, we will post the English version of this infographic in the chat box that you can download and use later on. But if you have clients who speak and read other languages, we also have this resource translated into multiple languages. So just let us know and we will share the translated versions with you as well. All right, so the next few slides are going to focus more broadly about fall prevention. I want to make the point to stop here for a little bit and check in if there are any questions so far.
No, I'm good.
I think we're still okay. Yeah.
All right. All right, so I mentioned, and I'm saying this over and over again, you know, prevention is better than cure, especially when it comes to falls in older adults. So we talked about one main strategy for prevention, which is checking home safety, and you now have a couple of resources to fall back on for this strategy. Here are some other strategies that you could be using with the older people in your lives that you are taking care of. If they have been recommended an assistive device, encourage them to use it. Sometimes older people feel awkward or feel some shame or stigma in using mobility aids, but the mobility aids are there for a reason. They're supposed to improve their mobility, not restrict it. So do encourage them to use their aids, like, you know, walking canes and walking frames. Whatever they do, encourage them to keep moving. We've seen earlier how lack of physical activity can lead to lean muscle mass loss as people get older, and that in turn leads to reduced strength and endurance and increases people's risk of falling. So encourage them to keep moving. But as they're moving, it's important for them to use correct footwear. So their footwear has to fit them right. It has to provide appropriate support and stability to their feet and ankles. When they're exercising, it's important that if they're using a particular surface for support to exercise, that those surfaces are steady and stable. So if you, for instance, go on YouTube, a lot of the exercises for older adults involve, taking the support of a chair. And sometimes when I look at the type of chair or furniture being used, it makes me a little nervous. So if you're going to use, a chair to hold on to as you're doing a single leg raise, for example, it needs to be a very sturdy chair. It cannot be a swivel chair or a chair with wheels. Better still, hold on to the kitchen counter, right? Because that's a more steady, stable surface, and will keep you safe while you're exercising. And lastly, encourage people to speak with their healthcare provider, both about preventing falls, but also if they've had a fall, to report it to their doctor. And we'll talk about that a little bit more. All right, so when it comes to fall prevention, what are different things that you could bring up at a doctor's appointment? I mentioned earlier, iron deficiency, vitamin D deficiency, protein deficiencies, all could, lead to a higher risk of falling among older adults. So a doctor's appointment would be a good opportunity to discuss and get tested for these nutritional deficiencies, and possibly, consult with the doctor about how their diet could be changed to make sure that they're no longer deficient in these important nutrients. Making sure that if they're experiencing any changes in vision and hearing, they get a referral to go see a specialist, an ophthalmologist for their eyes, an audiologist for their ears, so they can get checked out. These are typically problems that can be fixed. So getting a hearing aid, I know it's not cheap, but getting a hearing aid can go a long way in improving an older adult's hearing. Same for getting corrective glasses or surgery if recommended. If the person is on medications and they have noticed the medication making them dizzy or sleepy, then they need to bring this up with their doctor and possibly discuss a change in dosage or discuss some alternative way of managing their condition. And finally, since physical activity and mobility are so important, they can also discuss with their doctor about some suitable exercise programs. And we'll talk about some evidence-based exercise programs in a little bit. Oh, sorry. I don't know why there's a pre-recording on this slide, so I'm going to move on quickly from this one. But what you saw on the previous slide was actually a fall risk calculator. Actually, I might just stop sharing and quickly fix that and pull it up again for you. All right, so I don't think that should bother us anymore. I'm going to pull it back up. All right, so the National Council on Aging has developed this free tool. It's called the Fall Risk Calculator. So you go online on the URL that is on this slide, and then it asks 13 simple questions. So the person taking this assessment needs to answer these questions as honestly as possible. And at the end of it, they will get a fall score. And they can discuss their fall score with their doctor at the next appointment. Sorry that the slides keep progressing. Yeah, so at the end of the 13 questions, the person would get a fall score as well as some customized recommendations on how they could prevent falling. So, if someone has a doctor's appointment coming up, they can calculate their fall risk and take a printout of their score as well as the recommendations and bring it up at the next appointment. All right, so I've been saying this over and over again, but staying physically active by getting regular exercise is important. It's equally important to stay socially active because remember, becoming disengaged socially means depression, and depression is associated with risk of falling. So older people should be encouraged to participate in regular social activities and hobbies as much as possible. And maybe, they can participate in these activities at a local senior center or find opportunities around them to volunteer. For example, volunteering at a charity organization or at a food pantry, whatever it is that helps them get out and be more socially active. All right, so what types of physical activity or exercise are good for preventing falls? So if the person in question is frail and is not very used to doing physical activity and exercise, a good place for them to start might be chair yoga, right? This is when you're safely and comfortably seated on a chair and doing modified yoga that kind of helps you move a little bit, improves your strength and flexibility without necessarily challenging your balance too much. Traditional exercise such as Tai Chi, Qigong, and yoga have all been shown in research to improve balance, flexibility, and strength. Another form of exercise that is great for fall prevention but should be practiced under the supervision of a professional, typically a physical therapist, is called perturbation-based balance training. And this is where the physical therapist will teach the individual how to regain their stability by simulating unexpected slips or trips in a safe, controlled environment. Because, while there are different environmental hazards that increase someone's risk of falling, we can't always control our environment. We can't always predict, when we're going to go out for our daily walk around the block, that there won't be like a rock in our path, or, there won't be a puddle from like today's rain in our path, right? We can't control our environment. So it's important to rebuild our own body's ability to regain balance anytime we are challenged, right? So in perturbation-based balance training, the physical therapist will challenge your balance by pushing you in a certain direction and then training you how to regain your balance when your weight dynamically shifts suddenly. There are also some evidence-based fall prevention programs that are out there that are available through senior centers and area agencies on aging. So I'm going to mention the three that are most common. So one of them is Fit and Strong. Fit and Strong was developed by a research group at the University of Illinois, Chicago. We have included a direct link to their website. Typically, the Fit and Strong program is offered in person. And if you go to that website, you should be able to find locations in the entire state where Fit and Strong is currently being offered. Another evidence-based fall prevention program is Matter of Balance that was developed by Maine Health. This program is offered both online and in person, and the neat thing about it is that it's available in some languages other than English. So currently it's also available in Chinese, in Korean, and Vietnamese. And then the Tai Chi for Health Institute also has some programs that offer Tai Chi exercises. They currently have a Chinese version, both in voice and a transcription, as well as a Persian transcription available on their website. If you visit their website, you can try out a free lesson from one of their different Tai Chi programs. All right. So the next, set of slides is about how caregivers, both formal and informal caregivers, can prevent falls and can keep themselves safe as they are supporting an older adult. So a lot of times caregivers are involved in very hands-on tasks like helping the person get out of bed, get into their wheelchair, helping them get dressed, etc. All of this requires transferring from one surface to another. And when transfers are not done safely, there's a risk of falling for both the older person as well as the caregiver. So here are some safe transferring tips that might be helpful. Before starting a transfer, always tell the person what you're going to do. So make sure that if they're transferring from the bed to a chair, the chair is positioned right next to the bed, and the person knows that, this is what we're going to do now. It always helps to do a countdown with the person and practice before you do the real thing. So you can tell them, all right, so I'm going to count backwards, 3, 2, 1. And when I say 1, you initiate the transfer and I will help you as you do it, right? So let's try that now. So always give them a count so that they're initiating the movement and you're initiating the movement at the same time. As a caregiver who is supporting transfers, you want to make sure that your feet are far apart enough that you get a wide base of support. So they should be at least shoulder width apart. Make sure that you are wearing non-slip shoes and socks so that you're comfortable and you're not at risk of falling as you're managing someone else's weight. And try to get as close to the person you are lifting or transferring as possible. Something that caregivers always forget is let your legs do the lifting. So bend down and do the lifting. Don't bend over at your back because your back muscles are not strong enough and you're going to risk injury. So remember, let your legs do the lifting. And as you're doing it, something to remind yourself, just contract and tighten your stomach and back muscles, so that becomes a reminder for you to maintain correct upper body posture and use your legs as you're doing the transfer. All right, so so far we've been talking mostly about things to do to prevent falling. There are some things that need to be kept in mind in the event that someone unfortunately experiences a fall. So a lot of times caregivers are kind of caught unawares and don't know how to help the person get up, and they react rather than responding calmly. So what we have on the slide are a couple of strategies to help the person who has fallen get back up in a safe, comfortable position. So I'm going to play both of these strategies for you. And I want to make sure that I share the sound. I might have to stop and pull up my slides again so that the sound plays. All right. So let me know if you're not able to hear the sound as I play these demonstrations.
Falls happen. We need to respond and not just react. A reaction would pretty much look like this, saying get up or pulling them, which is not a good plan. Let's look at options that are better. First, calm and reassure them and help them get their shoes on before getting them up. Option 1 would be to place a chair behind them and help them to position themselves to pivot around. Cue them to get up on their knees and to take support to pull themselves up, turn, and sit comfortably. Option 2 would be to ask them to bring their arms in as you squat down for a safe lift. Ask them to shift from behind to build momentum so that they can push themselves up with your help.
All right, so that takes a little bit of practice. So if you've never done that before, maybe find a partner who you're comfortable practicing with and do it a couple of times so that next time if someone falls in your presence, you can respond instead of reacting. All right. All right, so now someone has fallen. You might have witnessed the fall, in which case you can help the person determine some details that could have led to the fall, or you might be just hearing about it from them. Regardless, it's important to help them jot down some details so that they can explain what happened accurately to the doctor. So here are some details that are important. How did they feel just before they fell? For example, were they feeling dizzy, weak, tired, confused? Was their vision blurry? Because that's going to help the doctor determine what led to the fall. Where were they when they fell and what were they doing? So for instance, had they just finished taking a shower and they were just stepping out of the bathtub, which might mean that there could have been water on the floor that made it slippery and hard for them to keep their balance. Have them reflect on whether there have been any recent changes in their health, or if you've noticed any changes in their health. Did they start a new medication? Have they stopped or changed the dosage for a medication? Were they recently hospitalized for a medical procedure, or have they been feeling depressed? All this is important information for the doctor. Also, have they gone through a stressful event lately, which might have, made them very distracted, like having lost a loved one, moving or retirement, those big life changes that make you very distracted and unable to respond to environmental hazards that could increase risk of falling. And then, it's always good to help older people prepare for a fall just in case, right? So maybe they can have a telephone in all areas of the home, or always have their cell phone on them so they can call for help in case a fall happens. If they have landline phones, then they should be kept on low shelves or tables so that if someone has fallen on the floor, they can still reach the phone. It's not out of reach for them. You can help them load emergency contact numbers and put it on speed dial on their cell phone so that they don't have to actually find the contact and then dial. They can just, do a speed dial, and whoever they need to reach can immediately be notified that they've had a fall. If they live alone, maybe you can help them set up a plan to have 1 or 2 people call them every now and again and check on them to make sure they're doing okay. This person could be a friend or a family member who, calls them daily or, a few times every day. So just in case they've fallen and they're not responsive, someone knows that something is wrong and they need like a visit, a wellness visit. Consider installing personal emergency response systems. So these can be, really simple, like wearable pendants with a call button, or really advanced in-home sensor networks where someone around you gets notified and immediately comes to your assistance in case there has been a fall. All right,
Thank
so
you.
I know there was a lot of information. I want to make sure that if you have any questions, I answer them, but also leave you with a list of references and resources for future reading. So that's the end of, all my talking. If you guys have any comments or questions, I'd be happy to take them at this time.